Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic, 5 things to know about epidural steroid injections. They were first performed in the 1950s, so we have 60 years experience with epidural steroid injections. The purpose in pain management is to relieve the pain of pinched nerves in the spine. Most commonly they are performed with cortisone. There are different types of cortisone, but overall that's what they're used with. The first thing to know is what are the indications for an epidural injection. Number one is a herniated disc with sciatica. You can see that here. You have normal disc that goes about these lines. Here it's herniated out from the inside, and it's squeezing on this nerve as it's trying to get out from the spine. Okay. Now, in and of itself, that's not very painful, but it sparks up inflammation, and that's why it's shown here in red. Okay. Spinal stenosis is when arthritis overgrows bone or soft tissue and pinches on nerve roots as they're trying to get out from the spine. And the degenerative disc disease in and of itself, so let's say you don't have this herniated disc, but you have a tear, that can cause pain, inflammation, and encompass this area as well. The second thing to know about epidural injections is how exactly do they work. Cortisone is a hefty anti-inflammatory medication. So it doesn't cure the problem it's being injected for, but it does work well for pain relief. So what it does is if it comes around this area, it soothes this inflamed area and provides pain relief. It can stick around for weeks to months and slowly dissolve, and hopefully by that time, this piece of disc will have disintegrated and the person won't need surgery. The third thing to know is that there are 3 different types of epidural steroid injections. We'll go through these. The first is an interlaminar injection. So here's a spine from the side. You have a lamina, interlaminar. So in the area where this soft tissue is, the needle goes through that soft tissue, and then in the epidural space is where the steroid goes. This is the first type of epidural injection that was developed back in the 1950s, and it's still commonly performed today. The most common new type is a transforaminal epidural, and this is where the needle goes to where the nerve root is getting out from the spine through this foramen. Okay, it's getting pinched right there, so this places the medicine very close to where it actually is getting pinched. All right, and it works extremely well. The third type is a caudal epidural injection. You can see here the needle goes very low. This is the sacrum. So it goes through this area called the sacral hiatus. A larger amount of steroid and numbing medicine is injected, and it migrates up to several areas. So if you have stenosis with several nerve roots getting pinched, it can help relieve the pain from all of them. The fourth thing to know is what are the outcomes of epidural injections? Well, there have been dozens of studies performed in the last couple of decades, and when you put them all together, 75% of patients receive good to excellent relief from the procedure. Now, the best studies include randomization and some sort of image guidance, whether it's ultrasound or x-ray guidance. Otherwise, studies show that without that, up to 40% of epidural injections are misplaced. Okay? So it can be deceiving if they don't have such a good outcome. A recent study in 2012 looked at a prospective study of patients with radicular pain caused by degenerative lumbar spinal stenosis, and that after transforaminal injections, 3/4 of them noted at least a 50% reduction in pain scores, 64% had improved walking tolerance, and 57% had improved standing tolerance at 1-year follow-up. So simply after the epidural injections, those were the results, which are really, really good with such a low-risk procedure. The fifth thing to note is that epidural injections are not FDA approved or denied. Okay, they're used off-label, just like 40% of the medicines in this country. Lots of treatments work very well for indications that they were not initially approved. It simply means that no company has taken the tens of millions of dollars that it would take to get a new indication from the FDA. Okay, when someone tries to say that, oh, they're not FDA approved, that means they're terrible, they're just plain wrong. Dr. Oz has tried to say that. Numerous other people have tried to say that. They are wrong. Okay. The bottom line is that epidural steroid injections are an effective treatment for pinched nerve conditions. They're outpatient, they have very low complication rates, and they can be repeated every so often. You can have a series of injections, say 3 every 6 weeks, and then you can repeat that series every few months as necessary. The top pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at NewJerseyPainNetwork.com and then call us for more information and scheduling at 844-2 2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.